and welcome to the Health Q channel. This is an health awareness channel, and here we talk about health tips, health education videos, and some of the advices from doctors and other healthcare professionals so that you can look at the brighter side of your health. Hello friends, I am Meghna Dave. I am host of this YouTube channel HealthQ and a physiotherapist. And in today's video, I am going to share top 10 exercises that physiotherapists usually prescribe to their patient who are suffering from knee osteoarthritis. These exercises are the exercises for the people who are in that stage of moderate to severe osteoarthritis, where the damage is pretty much more compared to the early stage people, where the joint gap in the knee is less, and due to which you are experiencing more pain, finding difficult to do some day-to-day tasks, and even you find the stiffness around your knee joint. So stay tuned with me to check all these exercises. But before we start exercises, do ensure you subscribe to this channel and share this video with your physiotherapist. Show it to them and ask them whether these exercises are fit for you before starting these exercises. So let's get started.
For this exercise, first take a towel roll and roll it something like this. This roll needs to be placed underneath the knee joint. Once you place the towel roll underneath your knee, then tighten your knee joint by pressing it downwards. You need to hold this position for around 10 counts and then release. You can do this exercise for 10 to 15 repetitions. Next exercise is called as VMO strengthening exercise. For this, you need a big pillow as shown in the video. Once you place the pillow underneath your knee joint, now try to raise your knee along with tightening your ankle. You need to hold this position for 10 counts and then come back. You can do this exercise for 10 to 15 repetitions for both the legs. This exercise is called as knee bending exercise. Here the aim is to enable the knee movement as much as possible. For this exercise, you need to straighten and bend your knee as much as possible. But you ensure that this movement should happen in a pain-free range. For example, while straightening and bending your knee, if you feel after a certain point it's not possible for you to bend your knee or it's too painful for you to bend your knee, don't go beyond that. Just maintain that particular range. This exercise is called as the straight leg raise exercise. For this, again you need to lie down straight and lengthen your leg or else raise your leg about 45 degrees. You do not need to hold this position but just raise your leg and come down. This exercise is called as the side lying straight leg raise. The aim of this exercise is to improve the strength of your thigh muscles. Lie down on one side of your body and then raise your leg till 45 degrees. This exercise is called as prone knee bending exercise. For this, you need to lie down on your tummy and then try to bend your knee and bring it towards your hip as much as possible. Again, do ensure that you do this exercise in pain-free range, which means don't bend your knee beyond the point where it becomes discomfortable. This exercise is to improve the strength of your front thigh muscle, also called as quadricep muscle. Sit on a stool and then try to raise your knee and hold this position for 10 counts and then come back. To increase the complexity of this exercise, you also can add some weights to your ankle and then do this exercise. This isn't stretching exercise. For this, just try to place your heel on the stool and then try to touch your toes with your hands. When you do this, you will feel a certain kind of pull on your back thigh muscle as well as the calf region. This means you are doing this right exercise. This is a very important exercise. Basically, in this, what you need to do is just to try to touch your kneecap bone. By pressing your knee, you would be able to recognize the edges of your kneecap bone, and then you need to move this bone up and down and side to side. The last exercise is called as partial squats. Here you need to take some support of the wall, bring your hands forward, and then try to bend your knees very gently and very mildly. Don't go beyond the point of pain. What you are doing here is trying to bend your knee, and with the help of your body weight, the knee would be able to move to a certain extent.
So friends, these were top 10 exercises that physiotherapists usually prescribe to their patient who are suffering from moderate to severe osteoarthritis who want to avoid knee replacement surgery. But do remember, these exercises cannot replace the prescription that is given by your physiotherapist or your orthopedic surgeon. So I would highly insist that you share this video with your physiotherapist, ask them whether these exercises are fit for you or not, and then start this program. On that note, see you on another video. Bye-bye.